Welcome back to Thrani, I'm Joe B. Today I'll show you how I successfully treated a patient with S-Curve Scoliosis who had a noticeable pain reduction and improved posture post-session. Let's dive in. An S-curve scoliosis is a lateral curvature of the spine that can occur at the thoracic and lumbar region. For easy understanding, we will name it based on if it's a traditional S or a reverse S. A traditional S is when the thoracic spine has a levoscoliosis or left-sided convexity, while the lumbar spine has dextroscoliosis or right-sided convexity. This means that in the thoracic spine, if the convex or bulging side is on the left side, due to right side bending and left vertebral rotation, it is called a levoscoliosis. The left rib will then move superiorly, posteriorly, and rotates. The right rib, on the other hand, will move inferiorly, anteriorly, and internally rotates. In the lumbar spine, if the convex or bulging side is on the right side due to left side bending and right vertebral rotation, it is called a dextroscoliosis. A reverse S is when the thoracic spine has a dextroscoliosis or right-sided convexity, while the lumbar spine has a levoscoliosis or a left-sided convexity. This means that in the thoracic spine, if the convex or bulging side is on the right side, due to left side bending and right vertebral rotation, it is called a dextroscoliosis. The right rib will then move superiorly, posteriorly, and externally rotates, while the left rib will move on inferiorly, anteriorly, and internally rotates. In the lumbar spine, if the convex or bulging side is on the left side due to right side bending and left vertebral rotation, it is called a levoscoliosis. The cause of this can be due to neuromuscular conditions, birth defects affecting the bone development, and spinal injuries. S-curve scoliosis can bring about a localized dull aching pain on the mid to low back. You can also notice one side shoulder and hip to be higher. For instance, if you have a reverse S scoliosis, then the right shoulder and the hip will be higher. During forward bending test, you will also notice one side of the mid-back to be higher, as well as the opposite side lower back. The assessment for the presence of an S-curve scoliosis requires the patient to perform a forward bending test. The patient is in an erect, relaxed, standing position with arms at sides and base of support at 2 to 4 inches. The therapist will be behind the patient with eye level, preferably at the pelvis. The patient is instructed to bend forward as far as able while keeping the knee straight. The therapist observes the presence of a rib hump or elevated side of the back, indicating the convex side of the scoliotic curve. Normal findings are that both sides of the back and buttocks will be leveled. Abnormal findings is that the right buttock will be lower than the left, and the right side of the back will be higher than the left. This indicates right thoracic spine convexity or dextroscoliosis and left lumbar convexity or levoscoliosis. In standing, the right shoulder and hip will be higher than the left. For the treatment, let us say your patient has a reverse S-curve scoliosis, which is a thoracic dextroscoliosis and lumbar levoscoliosis. The patient will be in a quadruped position, and the left hand and knee are moved as far forward as able, while the right knee is moved as far backward as able. The position is held for 30 seconds for 3 to 5 reps, 2 to 3 times a week for 1 to 3 months. So do you want to learn about how to prevent progression of a C-curve scoliosis? If so, then watch this next video. Thank you so much.